let's go. The anterior cruciate ligament, or ACL, is one of the four main ligaments comprised within the knee joint. It connects the femur to the tibia, and it makes rotative movements such as cutting, pivoting, and landing possible, essential for those participating in physical activity. Now, when injured, this ligament is frayed or torn. Unfortunately, though, there are over 400,000 ACL tears that occur each and every year in the U.S. alone. Now, recovery for this injury is no small feat, with it requiring patients to have surgery and with recovery times for up to a year just for the individual to resume pre-injury functionality. Now, unfortunately, I myself too have suffered and endured this dreaded ACL tear. Good morning, everyone. My name is Chloe Smith, and today I'm going to be presenting my research on a comparative analysis of the ACL tears per year and the implementation of prevention programs in high school athletics. Now first, I want to explain what exactly happens at the site of an ACL tear. I'm going to play this short video clip and explain what's going on. So as you can see, we have our healthy ACL placed between our femur and the tibia bones. However, when the femur and tibia are rotated in opposite directions of each other, this is when our torn ACL occurs. Patients describe this sensation as a very loud popping sound, very similar to that of cracking your knuckles. Now, although there are a lot of ACL tears, there are actually certain things we can do to mitigate this risk. In fact, certain preventative measures have been seen to reduce ACL tears from anywhere from 30 to even up to 50%. But what I found even more shocking than these results is that in all my years of playing high-level competitive sports, I was never actually introduced to any of them, and that is the driving force behind my research question today. And my research aims to answer a few specific things. First, I want to see just how many schools are actually implementing ACL prevention. Secondly, I wanted to see if these preventative measures are actually being done effectively the way that research has intended for them to be done. Now lastly, I want to see if both of these things combined have had any influence in the overall trend of ACL injuries in the last 16 years. Now, in order to understand how to prevent something, we first need to understand the causes. There are actually certain things that can increase your likelihood of tearing your ACL, and the three that I'm going to be discussing today are being female, the playing surface, and being a repeated patient. You see, statistically, females are 4 to 6 times more likely to tear their ACLs when compared to men. Now, this is due to certain hormonal and anatomical reasons. In fact, there's over 80,000 high school female athletes that tear their ACLs each and every year. See, women face hormonal fluctuations during different stages of the menstrual cycle, and this introduces something called knee laxicity. Essentially, this means that the ligaments become weaker. The National Institute of Health conducted a study where they took a group of women ages 21 to 32 and tested their knee laxicity levels on a variety of different days during the menstrual cycle. The study found that as the menstrual cycle increased, there was significant knee laxicity increase as well. This proves that women's ligaments are weaker and able to withstand less stress. Additionally, women also face anatomical differences and are more likely to have a condition called knee valgus and land with their knees in a position called knee valgus. Essentially, this is a position when the knees bend inward towards each other. In this image right here, you can see our knee is pointed towards the midline of the body, with the rest of the leg pointed outwards. The playing surface also plays a very noticeable difference as well. Natural grass and artificial turf are the two most common playing surfaces for sports such as soccer, football, and lacrosse, just to name a few. They both have their inherent flaws. However, ACL tears have been statistically proven to be more likely to occur on artificial turf than natural grass. The National Institute of Health studied NCAA football players from 2004 through 2009. With over 10,000 athlete exposures between a variety of practices and games, the study found that ACL tears were 1.39 times more likely to occur on turf than grass. Additionally, non-contact ACL tears had an over 44% chance of occurring on turf, while only a 36% chance of occurring on grass. Turf is able to provide more consistency to avoid weather conflicts. However, it's a much harder surface, which decreases the absorption when landing on it. Now, the final notable high-risk group are those who are repeated patients, or those who have previously torn their ACL. Now, 1 in 17 patients who sustains an ACL tear will sustain another ACL tear within the first 2 years of surgery. Once the body has recognized that it is capable of such action, it simply makes it far more likely for it to occur again. Now that we understand what exactly causes an ACL tear, we are better able to understand how exactly to prevent it. Preventative measures are simply exercises that can decrease your likelihood of tearing your ACL. Some common examples can be strength, flexibility, plyometric exercises, or even proper landing techniques. The list can go on and on. However, most notably, I want to talk about neuromuscular training for just a second. Neuromuscular training is getting the brain more comfortable in high-intensity situations. In high-level sports, our brains are oftentimes trying to juggle so many different variables, such as how fast can I get from point A to point B? What's going to be my second, third pass? Wait, my coach is also yelling at me. When our brains are trying to handle all of these different variables, unfortunately, sometimes it does make mistakes. And unfortunately, sometimes the very first thing to go can be your form. You didn't land properly. You might have landed with your knee in that dreaded knee valgus position. So neuromuscular training is getting the brain comfortable in these uncomfortable situations. In these examples on screen, we can see our subject here is shuffling back and forth between some blinking lights. And in this image right here, our subject is performing some basketball handling drills while balancing on a single leg. These can be literally as simple as having to solve a math problem while performing a high-level exercise. Regardless of the preventative measure, research makes it very clear how these are intended to be done. Research recommends that these program sessions should be anywhere from 20 to 30 minutes long. They should be conducted several times per week, and they should also be conducted from the preseason all the way out through the postseason for the most optimal results. It's also very important to note that each program should have an appropriate balance of each individual component. However, we now are facing a new problem, which is the widespread implementation of these prevention programs. However, awareness and education alone are simply insufficient in ensuring the widespread adoption of these programs. The National Institute of Health conducted a study to see how coaching adherence actually play a role in adhering to these prevention programs. They divided a group of 22 teams into intervention and control groups. The coaches that were in the intervention group attended a 30-minute workshop where they received printed materials on all things how to prevent ACL tears, while the control group did not. Now, with nearly 400 observed practices and games, the study found that the coaches in the intervention group, they actually corrected the improper technique and improper form found within their athletes. Now, this proves that coaching education is essential if we really want widespread adoption of these programs. But this leads us right into our study, and I conducted a comparative analysis between ACL tears in high school age athletes and its correlation with the implementation of preventative programs. I got my data for the trend of ACL tears publicly sourced from the High School RIO annual reports. This is a public database in which 100 participating schools send in all of their information regarding their school's injuries. I studied the years 2008 through 2009 all the way up to the most recent school year of 2023 through 2024. I found the total number of ACL tears for each given year, and then I placed them into a bar graph to assess their potential trend. In order to get feedback from the schools, I sent out a survey to nearly 300 different schools. In order to be included in the study, these schools had to be a public 5 or 6A high school. I was hoping to get at least 30 responses so I could at least have 1/3 of that 100 participating schools. Luckily, I did receive 35 responses. I did keep responses from these schools anonymous just to ensure their privacy. This is an example of what my survey looked like. The first question, does your school implement injury prevention? Second question, if so, what? I'm going to introduce you to a few of the further questions a little bit later on. And this brings us right here to our results from my study. So as you can see, this first graph here is the number of ACL tears per year. Although it may look like there is significant fluctuation from year to year, I want to point something out. Right here in the year 2014 through 2015, we can see that this year has the most ACL tears at 273. I also want to point out that after this noticeable peak, there does appear to be an overall decline to this data. Now, I think that this is very closely related and has a correlation with the first question I asked on the survey, which is, what percent of schools are actually conducting ACL prevention? These answers are very similarly split. 45% of schools say they do implement injury prevention, while the other 54% of them do not. Because more than half of these schools are not actually addressing ACL prevention, this does suggest a gap in the widespread adherence. Again, I do think that this did play a role in the overall decrease of injuries, but I do think the decline could be more substantial for a very noticeable reason, which I will point out a little bit later on. This next question is what preventative techniques these schools are actually using. Without a shadow of a doubt, strength training comes in at number 1, followed by plyometric exercises, core strengthening, so on and so forth. However, neuromuscular training is so far down on this list, and only 37% of schools using it. Strength training, it doesn't necessarily shock me that it is so far up, just because it is proven to reduce injury by strengthening the muscles surrounding the knee. But neuromuscular training being so far down does pose a few red flags, because this is essential for improving athletes' coordination and improving and preventing that dreaded knee valgus position that we talked about. This next question is very positive to me. How long have ACL prevention programs been in place? An overwhelming majority of schools, at 75%, have had them implemented for more than 3 years. This is very positive because this does support the growing trend towards a long-term commitment in actually wanting to reduce these ACL injuries. However, here's where things start to get a little tricky. When looking at the frequency of these prevention programs, I gave schools the option between daily, weekly, and seasonally. Now, if you remember, research does recommend that these programs should be conducted several times per week. However, only 37% of these schools are actually doing that properly. An equal number of schools are just conducting these programs seasonally. This poses huge concern for me because schools that are conducting these programs seasonally are simply lacking consistency within their programs. Consistency is what actually allows athletes to build muscle. Consistency is what allows the brain to be rewired to actually have muscle memory. So the schools conducting prevention seasonally are simply just not effectively practicing their programs. We can see the same inconsistencies found here when looking at how long these program sessions are. If you remember, the recommended length is anywhere from 20 to 30 minutes, but only 53% of schools are actually doing this properly. Some of these schools are even exceeding 30 and 45 minutes. The schools that are allocating less than 15 minutes to prevention programs may not be putting enough time towards other necessary areas. This may explain why neuromuscular training was so far down on that list. But schools that are exceeding 30 and even 45 minutes, these schools may simply be increasing fatigue in their athletes, which also poses a huge concern for injury. Now next, I wanted to ask schools, have they actually noticed a change in their ACL injuries? Research makes it very abundant that these are successful, but I wanted to see if the schools noticed a change themselves. So I asked them, how much of a change have you noticed? 46% of schools said they decreased slightly, another 20% said they decreased moderately, and then about 6% said they decreased significantly. However, no schools reported an increase in injury, which is expected. But also, some schools said it was too early to tell, or they were simply unsure. However, this is extremely positive to me because most of the schools said that the programs were actually effective because they noticed some type of positive change and a decrease in the injuries. Now, the last question that I went ahead and asked schools is, are your coaches educated on ACL injury prevention? These answers are very similarly split, similar to a previous result. 48% of these schools are educating their coaches, and 51% of them are not. But again, these results look very similar to the first question we asked on the survey. So let's go ahead and toggle back to that first question, looking at the percent of schools conducting ACL prevention. These numbers are very similar, and I suspect this is because of a direct parallel. I think that if schools are implementing injury prevention, you can probably bet that their coaches are going to be educated, but I do think those go hand in hand. If you have a school who's not implementing any injury prevention whatsoever, you can probably bet the coaches are also not going to be educated on the subject matter. It is important to note a few limitations that may be associated with my data. Because I did send out a survey, all of my data was self-reported, and this could have introduced some recall bias, which could slightly sway the accuracy of these schools' responses. Now, additionally, I did keep these responses anonymous to ensure the privacy of these schools. However, that might have played a role in the accountability and the honesty when these schools answered. It is important to note that there are other injuries. However, unlike ACL tears, other injuries have actually prompted significant legislation changes. For instance, the concussion. This is a traumatic brain injury caused by a blow to the head. But unlike ACL prevention, the concussion has actually sparked all 50 states to being required to have return to sport laws for medical clearance. This isn't just for high school sports. This isn't just for club sports. This is standardized and consistent across the country. This has proven that when there's been awareness for other injuries, there's actually sparked change. If this same idea could be brought to ACL tears, true widespread reduction would likely occur, assuming how important joint health is for longevity of athletes. And bridging right into longevity, ACL tears actually throw a huge wrench in this. One third of people who tear their ACLs will develop arthritis within the first 10 years of surgery. Now, with the average age of an ACL tear being 16 years old for just males and females, this means that thousands of young athletes will suffer from lifelong conditions before just the age of 30. Additionally, high school injuries place a huge economic burden on society. The National Institute of Health estimated just how much this financial impact with high school injuries alone was. it was estimated that there's nearly $10 million in medical costs, $45 million in human capital costs, and nearly $145 million in comprehensive costs. ACL tears are among the most expensive injury, with the average cost of an injury for an ACL tear being anywhere from $20,000 to even $50,000. Now my study focused just at the high school age demographic. ACL tears are still very prevalent among the collegiate and professional level. It'd be very interesting if future research took this same research format, but instead focused at the higher levels. Now we did see an overall decrease in the number of injuries, and I do think this was because around half the schools are implementing injury prevention. However, I do think that this was because a good amount of the schools were conducting injury prevention. However, I do think this decline could have been more substantial because we did have a massive variety of schools when it came to time, length, and type of prevention created. So we did find that just because schools were implementing injury prevention, that didn't necessarily mean that they were conducting that properly. So I'm going to end with this. If we're going to spend so much time, money, resources trying to ensure the widespread implementation of these programs, why don't we also enforce their accuracy? Thank you.
Thank you. Chloe, how did your initial exploration of the scholarly conversation lead to your final research question?
So originally, I was having a little bit of trouble narrowing, and I was focusing on ACL tears, and I was kind of just looking at ACL tear injury risks on turf and being female, and I wanted to see if you could cater specific training techniques to adhere to those specific risk factors. And I kind of did mention that a little bit earlier on, but I started there, and then I wanted to focus on just ACL tears in soccer, but then I realized that I kind of needed to get specific, and so I changed my research from focusing on all of these different variables to kind of combining them and find a holistic approach, which was seen when I looked at the overall trend.
How does your new understanding address a gap in the scholarly conversation?
So I did find that just because schools were implementing prevention, that didn't mean that they were doing this properly. So I think the new gap is not only should we be prompting the adoption for high schools, I do think that there needs to be an awareness for actually conducting these programs properly and for proper widespread implementation.
And then finally, what was the most important research skill you developed as a result of this process, and how might you apply it in future endeavors?
So without a shadow of a doubt, the hardest part for me was trying to get enough responses. I had to send almost 300 emails out just to get 35 responses. So a big part of me was nervous that I wouldn't even have enough to make an actual research project. So definitely consistency and perseverance was the most important thing that I learned. I would wake up every single day and send emails out first thing in the morning, and I'm really happy that I did that because it did pay off. But I plan to use these skills later on in college and even after college because I want to become a physical therapist. So I want to use these same skills that I learned throughout this research project and hopefully continue to research and learn about these same things at the college and at the graduate level.
All right, thank you.